Hi everybody, my name is Dr. Lauren Heinen. I am a physical therapist and Pilates rehabilitation-based specialist here in Oklahoma City. I work at Heinen Physical Therapy, and I am going to run you guys through a reformer class, one that I'll typically do with most any of my clients. It's very relatable to a lot of injuries, but mainly with a focus on low back mobility and stability. So I would typically use this with low back pathology. I'm trying to use as little props as possible, but I do like to have a squish ball for my side lying work. I am on a Balanced Body Allegro 2 Reformer. I have 3 reds, and I'm going to add a yellow for my footwork, just for a little bit of a challenge. I have my headrest up, but that is irrelevant. Have it up or down. We won't be doing anything that's going to be articulating the spine and crushing the neck. So you just be comfortable, whatever your preference is. So we're going to go ahead and get started with footwork. Laying down on our reformer. Trying to log roll to get on and off there. That's going to be really important, especially for our painful lumbar patients. Now to get set up, you're going to center yourself. Your heels are going to be hip-width apart on the bar. And we're going to go ahead and find that center of the heel. I want you to place your palms up first. Get that nice length and width through the collarbones. Keeping that length and width, we're going to go ahead and flip the palms down just at the wrist. Abdominals are going to pull in at the navel. However, I'm not pressing my low back into the carriage. So taking a deep breath here and just kind of letting the body process all of that. I'm going to inhale to prepare, and as I exhale, I'm going to go ahead and push my carriage out, weight bearing through the center of my heels. Slowly coming back in, using my hamstrings to slow down the spring tension pulling me in. So you're in control of that eccentric motion here. Pressing out and coming in. And we're just going to move through it because we're warming up. We want your body to kind of, get used to movement with footwork with our warm-up. So we don't want to rush it, but we do want to kind of pack in a bunch in this half-hour class. So one more, we're going to bring it in about halfway, and we're going to do little pulses. 4, 5, 6, 7, all the way out, and then back in. Heels are going to come wide on the bar. In a second position, my heel is still my weight-bearing portion, and I'm going to go ahead and push out and then come in. If you're working with ballet terms, we're in second position here. Abdominals are still pulling in. And we're going to feel this one a little bit more in the outer thigh, outer hip. As we push out, of course, we're still going to feel it in our quadriceps. And our abdominals are still pulling in snugly at the navel. 2 more. 1 more. Bring it in about halfway. We're doing our little pulses. Good. If you have somebody who's kind of moving around at the hips, guide them by telling them to place their tailbone, pressing that firmly into the carriage, just to give them an anchor point in space. You don't want to cue them to overly anteriorly tilt, but you just want them to have a nice little drop your tailbone heavily into the carriage, and that should help. Heels together, toes apart now in first position, or Pilates V on the heels, abdominals in as we push out and come in. Now another thing that I like to cue people through their footwork is as we push out, I want you to feel like you're pulling your spine up out of your pelvis, getting really long, nice length, axial elongation through the spine as we press out. Keeping that nice long spine even as we come in to the best of our ability. Making ourselves taller with each rep. 1 more, halfway in, and then we pulse. 2, 3, 4, 5, 6, 7, all the way out, and bring it back in. From here, we're going to take our feet a little bit wider than hip width, turning our toes and our knees in towards one another. Pressing out and coming in, We're in an internally rotated position. So in this position here, you may not be able to see on that camera angle, my thighs are touching until they can't touch anymore as I push out. Pressing out and in. Most people walk around in a retroverted hip or externally rotated hip. So this is a nice change, a nice little altered position for us to work in. It's opposite from what we typically see. One more. We got our little pulses here. This one's a doozy. 3, 4, 5, 6, 7, long all the way out and in. And now we're going to go into hip circles. We're going to turn out as we push out, turn in as we come in. Trying to make a nice smooth circle within the hip. And then we'll reverse our direction, staying out to come in to go out. Two more. Not quite a full count of 8. Now from here, I'm going to take my toes and place them on the bar. So here, my weight-bearing portion on the bar is the ball of my foot. And you want to evenly push out on all 5 metatarsal heads. You don't want to feel like you're pushing too far to the side of the foot or the inside of the foot. You want to be nice and spread out, weight bearing over all surfaces there. We've got 4 more. 3, 2, hold it out, and we're going to drop into running in place. So running in place, we want to bend one knee, keep the other knee straight, stretching a calf under the bar, heel drops, heel drops. Now I like to cue pushing in to the ball of the foot on the bent knee to initiate the change. 4 more. 3, 2, 1. We're going to go ahead and place that heel on the bar to get a little bit of an extra stretch. Sometimes I like to take the heel and kind of pull myself a little bit with it. You're going to do what feels good in your body and for your flexibility. And then we'll go ahead and switch to the other side. Good. And don't be afraid to take your time with stretching. Stretching is really important to do. It's something that I feel like we owe our bodies to work and operate at their optimal potential. And switch. I'm a lot tighter on my left side. And one more switch. Good. So now I'm going to take my feet and I'm going to bring it into a Pilates V on my toes. Okay, so I still want to feel like all 10 toes of are touching the bar, but my heels are together, and I'm still turned out. In this Pilates V, you want to make sure that your knees are no wider than the widest portion of your shoulders, widest point of your shoulders. And I want you to really feel like those inner thighs are zipping your legs together. Abdominals pull in, inner thighs zip together as we press out. 3, 2, on this next one, we're going to hold it out, and both legs are going to drop together and lift for 8, 7, 6, 5, 4, 3, 2, 1, and come back in. Very good. We're going to turn back to neutral, and I'm going to grab behind my knee of my right leg. From here, I'm going to press out so that both legs straighten, and I'm pointed through my right foot, as we can see right here. And then we're going to bring it back in and point. And in. And 4, 3. Purpose of this is to get a nice hamstring stretch. On this last one, hold it here, and now we're going to flex both feet and point. Flex and point. Flex and point. 4, 3, 2, really press that heel to the ceiling on this last one and then come back in, and we'll go ahead to the other side. I like putting this one in the warm-up because it's not too much of a terribly aggressive hamstring stretch. It's just starting to get the body to mobilize and move. Personally, I'm a lot tighter on my left side, so I'm going to put a little more care and attention into moving through this series here. Holding it here, we're going to flex both feet and press. And you want to reach the heels and then press, and reach the heels and press. 3 more. 2. On that last one, you're just going to hold it and push, 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 heel towards the ceiling. Feel that energy coming out through the back of the leg, nice length, and then come in. Good job. Heels back on the bar. The next stretch is a figure 4 stretch. So I'm going to take my right ankle over my left knee. Some of your clients and patients might be too flexible for doing it here, and then we're going to push out and in. And for them, I would recommend considering doing this with feet in the straps. You can get a little bit more mobility and more of a stretch utilizing the straps. My right foot is flexed as I push out and in. We got 2 more. We go 1 more. Now there'll be some people who aren't very flexible at all, and you're going to really want to cue that they keep that tailbone down as they come in. Don't allow them to bring the tailbone up, because then we lose our anchor for the stretch. So we're going to hold that there, and then we're going to go ahead and drop the right knee down towards the ground. Left shoulder stays attached to the carriage. Nice length through our left side as we stretch. And then bring it back to center. Drop that tailbone, hit that tailbone. And then we're going to come back down, getting a nice stretch on the quadratus lumborum, which often gets really tight, especially in lumbosacral pathology. And then come back in. And then go ahead and switch. Other side. Tailbone drops down, and we push out and in. We'll do about 6. Keep that tailbone down. Again, I'm a bit tighter on my left side. I'm taking great care as I come in to keep my tailbone connected. 1 more. And now I'm going to take the whole shape, and I'm going to bring that knee down to the ground, keeping my right shoulder planted. The right shoulder is my nice anchor for the stretch. Good. I like to give people an anchor point of their body when we're stretching and give them a little bit of rationale why, so that they know how to more efficiently stretch a muscle group. Good. All right. Excellent. We're going to turn to our side now and do a little bit of side lying footwork. You can keep the tension that you have on, or you can drop a spring if you need to. You're going to do what feels good for you, what feels challenging, but where you can also maintain your proper body form. I'm going to take a squish ball. We call this squish ball here around the clinic, and I'm going to place that around under my head. My headrest is still up. I'm going to turn all the way to my side. My toes are going to be neutral, pointed straight forward. My knee is like it's on a table, and if you need to, you're going to want to scoot your hips back on the carriage just a touch. My bottom leg is nice and long, and I've got my inner thigh, my adductors pulling or squeezing tight for this. Abdominals are pulling in, and my hips stay stacked. I'm going to go ahead and push out and come in. Then we're just going to do 8. 7, and 8, and then we'll pulse it. I love the little pulses to really get things fired up. And I'm really pushing through my heel here. 3, 2, all the way out. We're going to stay in this neutral position. We're going to push out about halfway, and then from here, we're going to lift and lower our heel, so lift up onto the ball of our foot and lower without allowing the carriage to move. This one's going to give me the shakies big time. Got a lot of quad control here. 4, 3, 2, and 1. Good. Push all the way out with a full foot and back in. We're going to take our knee and our toe towards the ceiling, and I'm still pushing through my heel, and I'm going to make sure I'm stacked nice and straight down towards the carriage. One long line. I'm pushing out and in. Abdominals pulling tight. Good. Gently arriving at the stopper each time. 4, 5, 6, 7, 8, little pulses. 8, 7, 6, 5, 4, 3, 2, all the way out and in. Very good. We're going to take our toes and we're going to point down. So we're internally rotating the hip now. A little trick that I like to give is to put your heel up on the padded part of the foot bar and take your toes and place them down on the rounded portion. Now, depending on what kind of reformer you're using, you may not have that option, but on the Allegro 2, it's kind of the perfect setup to get that nice internally rotated hip while having good support. Mind you, I'm still pushing through my heel. Try to resist the urge to push through the ball of the foot. You really want to activate the glute med minimus complex, and you're going to have a much better chance of doing that by pushing through that heel. Pushing through that heel. One more, and then we pulse. 8, 7, 6, 5. If you're following along at home, then you know that right now this part is miserable. Go ahead and push all the way out. And in. Woo! Very good. I want to maybe tenderize that a little bit. So now I'm going to take my bottom leg underneath me, and my top leg is going to go long out over the bar. This is what I call the finisher. My abdominals pull in. We're going to go forward and back for 8, 7, 6. Watch your tension in your hand. I felt myself grabbing on for dear life. 4, 3, 2, and 1. And now we're going to take it here and we're going to do little circles. So tiny golf ball size clockwise. 6, 7, other way counterclockwise. 2, 3, 4, quiet down the body here. Stay nice and steady. Just move through the hip. Size of a dinner plate. I want you to feel nice and long through the lower part of your abdominals here as well. Other way. 2, 3, 4, 5, 6, 7, and size of a wine barrel. Last round of circles. 2, 3, had to do all 3 sizes. 4, 5. If any of my regular Pilates people are watching, they know it's a signature move of mine. Couldn't skip it. And then the other way. 2, 3, whoo-wee. 4, 5, 6, 7, nice and long through that knee, through those toes. Hold it here, and then we're just going to go up and down for 8. 2, 3, 4, 5, 6, 7, and 8. Good. Go ahead and relax a moment. I'm going to go ahead and turn to the other side. My back is going to be to the camera, but that's going to give you the angles from the other side, so you can see where my hips are on the carriage. You can see what everything's doing on the foot bar, and I'm just going to talk a little bit louder so that you can hear me. So turning over to the other side, gracefully as possible. I'm going to make sure that my hips push back just a little bit. Top leg, neutral rotation. My knee doesn't drop. My other leg is long underneath the bar. I'm going to go ahead and push out and in. 2 for 8. 3. 4. I'm nice and long here on the bottom part of my body. Lots of life underneath there. Now I'm going to go ahead and pulse it. 8, 7, 6, 5, 4, 3, 2, all the way out, and in. I'm going to hold it about halfway. I'm going to lift my heel and lower without allowing movement from the carriage. One more, pushing through the heel all the way out and in, turning my toe and my knee to the ceiling. I push out and in. Remember, this inner thigh is working down here. Abdominals are working. Halfway in, little pulses. 2, 3, 4, 5, 6, 7, all the way out. And in, toes down, heel up, internally rotated through the hip, pushing through my heel so I really get that outer hip to activate. 5, 6, 7, and 8. Bring it in, little pulses. 8, 7, 6, 5, 4, 3, 2, all the way out. Oh, and in. Bottom knee comes under, top leg on top of the bar. We go forward and back for 8. When we open up into that extension, you don't want to let your hip fall back. You want to keep it stacked as you come back. 2, 3, 4, 5, 6, 7, and 8. From here, we're going to do little circles. 1, 2, 3, 4, 5, 6, 7, and switch. 1, 2, 3, 4, 5, 6, 7. Size of a dinner plate, keeping the hips steady. 3, 4, 5, 6. Try not to have any tension in the upper body. Do a little scan there. 2, 3, 4, 5, 6, 7. Size of a wine barrel. 2, 3, 4, 5, 6. Long through the toes, lots of energy. Other way. 2, 3, 4, 5, 6, 7, and 8. And then we go up and down for 8, 7, 6, 5, 4, 3, 2, and 1. Good. I'm going to go ahead and sit back up. And then we're going to get ourselves set up for reverse abdominals. Okay, so setting up for reverse abdominals, I'm going to lose my ball. And then I'm going to go ahead and take it down to one red spring. Some people may do better on a blue. You're going to want them to be able to smoothly move through the motion and be able to hold it at the end. without having to strain. So just go ahead and kind of watch them as they do it and make sure that they can achieve that movement smoothly. We want to be able to use our local stabilizers versus recruiting global things and straining on it. So to get into the position, I'm going to come into all fours, and I'm going to walk my knees so they're about a fist distance from the shoulder blocks. From there, I'm going to go ahead and take my hands and walk them out. Here's the cue that a lot of people, I think, like to hear, is you're going to want to set up almost like you're in half of a push-up position or a modified plank position. So my hips are here in a box. They come forward so that my hip bones are now in between my hands and my knees. From here, I'm going to pull my abdominals in. I'm going to press through my palms so my shoulder girdle is engaged. And I'm going to pull my abdominals in so that my knees come underneath my hips. I tap the carriage to my hand, I hold it there, and then I slowly and controlled come back to my starting position. So this exercise is achieved by allowing our knees to come under our hips, using the abdominals to facilitate the movement, and then allow it to come back. We're going to do 4 more. We're going to hold for just a moment at the end. And 3. 2. On this last one, we're going to hold it there for 8, 7, 6, 5, 4, 3, 2, and then slowly let it off. And then go ahead and rest a moment. I like to rest this one in child's pose. A couple notes about this one. This is great for prenatal back pain because it's a nice safe position in all trimesters to allow the baby to just kind of hang and not put any pressure on the lumbar spine and pelvis. If the mommy or the patient or the client has wrist issues, you can go ahead and place a short box on the rails and then just put your forearms on it, and that'll take out any kind of wrist strain. So that's a nice tip there if you have a client of that subset. So we're going to go ahead and make this a little bit harder as if it wasn't hard enough already. And I'm going to go ahead and set back up, but this time I'm going to take my right hand over my left. So I'm doing a little bit of oblique work here. Same things apply. I bring it in and I pull out. I'm strong through my shoulder girdle. Don't allow yourself to slump into your shoulders. You want to stay nice and strong, shoulders down, shoulder blades back. Trying not to strain. Using my deepest abdominals to pull that carriage in. Really scooping the belly. We got 1 more. Hold it here for 4, and 3, and 2, and 1. Coming back. And I'm going to the other side. Same thing. I set myself up, strong through my shoulders, and I pull in, hold it, and then slowly let it back. Pull in, and hold it. Slowly let it back. We got 2 more. Last one. And slowly let it back. Good. And I am officially breaking a sweat. Okay, good. So that was reverse abdominals, and that's a nice way to just change our positions and get into an all fours so that we're not on our side or on our back. We get a little bit of lat work there too from our engagement from the shoulders. We're going to do a little bit of strap work now, so as long as the client is fine being on their knees, I would say go forward with this. I'm going to take off my red, and I think I'm going to go ahead and do a yellow, maybe even a yellow and a half for some people. I'm going to take my straps, and I'm going to get them on their pegs. So this is going to be a 3-point kneeling exercise, and I think I'm going to go ahead and grab up near the D-ring of my strap. So I'm nice and long through my shoulder girdle. This hand here is on the shoulder block, and I'm not collapsing through that shoulder. I'm going to pull back, and then come back down. I'm keeping my nice alignment through my hips. I'm not allowing myself to scooch down. I'm staying long through my torso, and I'm pulling back. And in. Abdominals are pulled in nice and tight. 2 more. Last one, holding it here. I'm going to turn my thumb and I'm going to bring it up to a T and then come back down. Ooh, harder than it looked. Again, make sure that it's light enough for your client. This exercise might not be appropriate for people who have a weaker upper body. 1 more. I'm going to hold it here, and I'm going to go ahead and do a tricep kickback for 4, 3, 2, hold it out, 3, 2, 1, squeeze that tricep, and go ahead and bring it down. I'm going to drop the strap in, actually I'm going to leave the strap on the peg. That's going to come into play in just a moment. We're going to go ahead and go to the other side, grabbing here and pulling back. And 3. Good. Strong through my torso. 4, 5, 6, working the extensors by sitting up nice and tall, nice and long through the back. Hold it there. And then we're going to go forward and pull back. Just a couple. 2, and 1. Holding it there. And now I'm going to bend and straighten for 4. Nice tricep press. Squeeze the tricep. Squeeze. 1 more big squeeze of that tricep. Hold, hold, hold. Bring it down. Excellently done. Okay. Continuing to work our arms and also our abdominals, we're going to go ahead and lay onto our back 1 more time. So, I'm going to take myself down, and here, minding my spring tension, I'm going to bring it to a red and a blue. Take off the yellow. Laying back down. Don't forget to log roll. This time, I'm going to find my center of my carriage. I'm going to take my straps off the pegs, both of them. Small loops in my hands. Some of your equipment may have big loops and handles. If that's the case, you want the handles. So you're going to find your arms straight up 90 degrees from the shoulder, pressing into the strap. Legs are going to come to tabletop. Low back presses down. This is going to be extremely important for anybody who may have a compromised low back or a weakened low back. Or in abdominals, you want to make sure that they're keeping that spine imprinted down to protect the structures. We're going to bring the arms straight down, abdominals pull in, and coming back up. Really squeezing the lats as the arms press down and up. Squeeze the lats and up. And we're pushing into the pinky side of our hand as we come down. Now from here, you're going to add head, neck, and shoulders lift. You're going to pull the belly button down. You're going to hold it there for a moment. Arms go first, then the head, neck, and shoulders. And that's a little cherry on top that gives you that little extra something that really makes you feel like you did not phone it in today. We got 4 more. 3, 2. On this last one, we're going to hold it up. Now here's a challenge. We can either take both legs out and in, or if you need to modify, 1 leg at a time, but my head, neck, and shoulders stay lifted.
My shoulder blades are off of the carriage, pushing into my straps. My fingertips are long. 4 more. And 3. I'm sweating. 2. And 1. Arms come up. And we're going to go ahead and make a circle, holding the tension here, then coming down, not allowing the carriage to move as we make that transition. And going the other way, out, holding it. Really good control over those arms. 2 more. Holding it here, we're going to go ahead and lift up our head, neck, and shoulders. We're going to lower and touch the hands, not letting the carriage move. I'm unweighted from the stopper. Abdominals pull in, low back is pressing down. 4, 3, 2, and 1. And bring it in, feet on the bar. Go ahead and throw your straps. Let your arms belong to the side. I'm going to go ahead and let my knees go. 1. Okay, coming back to center, we're going to go ahead and come all the way off of our carriage. We're going to do one more exercise. We can go ahead and stay on our red and our blue here. We're going to be holding onto the carriage. Now there's probably a little ball or some sort of landmark on your reformer that you're going to place your standing foot underneath. The other foot, toe ball heel, onto the shoulder block, and now I'm going to take this and I'm going to drop it down. So I'm bending through my standing leg, which is my left leg. I don't have a whole lot of weight through my hands, they're just there for balance, or I can place them onto my hips for a challenge. From here, I'm going to push out, my carriage knee barely touches. This is called scooter. We're going out and in. This knee stays the same amount of bent. 2 more. I'm nice and long through my back. My abdominals are pulled in. Now I'm going to take that carriage. I'm going to press it back. I'm going to place my thigh on it, and I'm going to get a nice stretch through the front of my hip here. I'm going to squeeze my butt on this side and press. Good. There's a couple of different iterations that we can do here to make it more challenging, but for the sake of today, I just wanted a little bit of glute work to finish off and a little bit of a hip stretch, which is really, really nice, especially for those of us who sit at a desk for most of the day or drive. Just opening up the front of that hip feels so, so good, and it's great for the low back. Good. I'm going to walk around and get the other side. So from here, see, I'm dropped back into this hip. My knee does not go past my toes. I'm going to go ahead and push out and in. Again, you can put your hands on the hips so that you have to balance, or you can leave them here for a little bit of assistance. 2, 1 more. Squeeze that glute. Press the thigh to the carriage. Press it all the way back. I'm going to squeeze my bottom on my left leg, or my stretching leg, just to get a little more into the front of that hip. I'm going to hold, hold, hold. Go ahead and bring it back in. Go ahead and have a seat. Take a deep breath. You guys did great. That was a cool class. I really sweat through it. So hopefully that gives you an idea of some of the things that I like to do with people, and maybe you got a good workout out of it too. Thanks. Have a great day and be well.